Hey everyone, welcome back to the channel. Today, we're diving into a topic that's incredibly important for heart health, angioplasty. Whether you're here because you or a loved one is considering the procedure, or you're just curious to learn more, this video will cover everything you need to know about angioplasty. We'll talk about what it is, how it works, the risks involved, and what recovery looks like. So, grab a cup of tea, sit back, and let's get started. What is angioplasty? What exactly is angioplasty? Angioplasty, also known as percutaneous coronary intervention, PCI, is a minimally invasive procedure used to treat narrowed or blocked arteries, usually in the heart. These blockages are often caused by a condition called atherosclerosis, where plaque, made up of fat, cholesterol, and other substances, builds up inside the artery walls. Over time, this can restrict blood flow, leading to chest pain, shortness of breath, or even a heart attack. Angioplasty works by widening the blocked artery and restoring proper blood flow to the heart. It's often combined with the placement of a stent, a small mesh tube that helps keep the artery open. This procedure has become a lifesaver for millions of people worldwide and is one of the most common treatments for coronary artery disease. Why is angioplasty performed? Now, you might be wondering, when is angioplasty necessary? Well, doctors typically recommend angioplasty for patients who 1. Have coronary artery disease with symptoms like chest pain, angina, that hasn't improved with medication or lifestyle changes. 2. Have had a heart attack, as angioplasty can quickly open blocked arteries and prevent further damage to the heart muscle. 3. Are at high risk of a heart attack due to severe blockages detected during diagnostic tests like an angiogram. It's important to note that angioplasty isn't always the first option. In some cases, lifestyle changes, medications, or other treatments like bypass surgery might be recommended instead. Your doctor will evaluate your specific condition and decide if angioplasty is the right choice for you. How is angioplasty performed? Let's break down how the procedure works. Angioplasty is typically performed in a catheterization lab, or cath lab, by a cardiologist. Here's a step-by-step overview of what happens. 1. Preparation. You'll be given a local anesthetic to numb the area where the catheter will be inserted, usually in the groin or wrist. 1. You'll also receive sedation to help you relax, but you'll remain awake during the procedure. 2. Inserting the catheter. The doctor will insert a thin, flexible tube called a catheter into the artery. 2. Using live X-ray imaging as a guide, they'll carefully thread the catheter to the blocked artery in your heart. 3. Inflating the balloon. Once the catheter reaches the blockage, a small balloon at its tip is inflated. 3. This pushes the plaque against the artery walls, widening the artery and restoring blood flow. 4. Placing the stent. In most cases, a stent is placed in the artery to keep it open. 4. The stent is mounted on the balloon and expands as the balloon inflates. 4. Once in place, the balloon is deflated and removed, but the stent stays behind permanently. 5. Closing up. The catheter is removed, and the insertion site is closed with pressure or a small device. 5. The entire procedure usually takes 30 minutes to 2 hours, depending on the complexity of the blockage. 5. Types of stents. Now, let's talk about stents. There are two main types of stents used in angioplasty. 1. Bare metal stents. These are simple metal mesh tubes that provide structural support to the artery. 1. However, there's a risk of the artery narrowing again over time, a condition called restenosis. 2. Drug-eluting stents. These stents are coated with medication that's slowly released to prevent scar tissue from forming and reduce the risk of restenosis. 2. They're more commonly used today because of their higher success rates. Your doctor will choose the type of stent based on your specific condition and medical history. Risks and complications. Like any medical procedure, angioplasty comes with some risks. While it's generally considered safe, it's important to be aware of potential complications, such as 1. Bleeding or bruising at the catheter insertion site. 2. Blood clots forming inside the stent, which can lead to a heart attack. 3. Artery damage from the catheter or balloon. 4. Allergic reaction to the contrast dye used during the procedure. 5. Restenosis, where the artery narrows again over time. The good news is that serious complications are rare, and the benefits of angioplasty often outweigh the risks. Your medical team will take every precaution to minimize these risks and ensure your safety. Recovery after angioplasty. Now, let's talk about what happens after the procedure. Recovery from angioplasty is usually quick, but there are a few things you'll need to keep in mind. You'll be monitored for a few hours to ensure there are no complications. Most patients can go home the same day or the next day, depending on their condition. You'll need to avoid strenuous activities and heavy lifting for a few days. Your doctor will give you specific guidelines based on your situation. You'll likely be prescribed medications to prevent blood clots, lower cholesterol, and manage other risk factors. It's crucial to take these as directed to protect your heart and stent. Angioplasty isn't a cure for heart disease, it's a treatment. To keep your heart healthy, you'll need to adopt a heart-healthy lifestyle. This includes eating a balanced diet, exercising regularly, quitting smoking, and managing stress. You'll have regular checkups with your doctor to monitor your progress and ensure the stent is working properly. Long-term outlook. With proper care, most people who undergo angioplasty can expect a significant improvement in their symptoms and quality of life. However, it's important to remember that angioplasty doesn't eliminate the underlying cause of heart disease. That's why lifestyle changes and medications are so crucial. By taking control of your health, you can reduce the risk of future blockages and enjoy a longer, healthier life. Myths about angioplasty. Before we wrap up, let's bust a few common myths about angioplasty. Fact: it's a minimally invasive procedure with a quick recovery time. Fact: stents treat blockages, but they don't cure heart disease. Lifestyle changes are still essential. Fact: while it's more common in older adults, younger people with risk factors like smoking, diabetes, or high cholesterol may also need the procedure. Alright, that's a wrap on everything you need to know about angioplasty. If you found this video helpful, don't forget to give it a thumbs up and share it with anyone who might benefit from this information. And if you have any questions or personal experiences with angioplasty, drop them in the comments below. I'd love to hear from you. Remember, taking care of your heart is one of the best things you can do for your overall health. So, stay informed, stay proactive, and I'll see you in the next video. Until then, take care and stay healthy.